Hello, Periodontist Daryl. How have you been?
Good, Dentist Kirk. I have not seen any new referrals from your office for implants or periodontal procedures in the last 6 months. I hope you are not unhappy with our care of your patients.
No, I'm not unhappy. I'm placing my own implants and providing periodontal surgery in my office.
Really? How did you manage to do a periodontal residency and keep your practice running?
I'm currently in a year mini residency at an online implant institute. I bought a CT scanner and a laser.
What is the laser for?
Periodontal surgery. I can do flapless debridement and the patient will not have to have expensive periodontal treatment in your office. The patient will have more money to do more cosmetic procedures in my office.
You are joking, right? Where is the science to support this protocol?
My laser rep says it is great and the best way to boost my production for periodontal procedures. She is hot. She is only 26 credits away from a communications degree at Washington State University.
Do you know what the AAP position is on lasers for periodontal treatment?
What is the AAP?
You are kidding, right?
My patients are very sophisticated and demand I use the latest technology.
Do you have your patients sign consent for this experimental therapy?
I do not want to talk about lasers anymore. I want to talk about implants.
Okay. I have not had any referrals from you for implants for some time. Why do you want to talk about implants with me?
Sally, a patient you placed an implant on last fall, has bone loss. She is going to lose the implant.
Wow, that surprises me. I remember that case, and we had extremely good integration with the head of the implant, placed 3 mm below the gingival tissue on the buccal. I placed the implant so that the screw access would come through the cingulum.
I did not use a screw-retained crown.
No problem, I am sure the custom abutment looked very good.
I used a stock abutment to save on the laboratory fee. This is more profitable.
If the buccal margin is 3 mm deep, the interproximal must have been 6 mm deep. How did you remove the excess cement? Your implant is likely failing due to excess cement causing peri-implant disease as described by Tom Wilson's paper I gave you before you restored the implant last December. You did read it, didn't you?
I'm much too busy with new equipment for my office to be reading every paper that is given to me by a specialist. Besides, I'm becoming an expert on dental implants. I have spoken a number of times on how the general dentist can increase profits by doing implants.
How does that make you an expert?
I have bought a CT scanner.
You're joking. Back to Sally. Do you see cement on the X-ray? What cement did you use?
I do not see cement on the X-ray. I used an implant-specific cement recommended by my supplier representative. She is very cute. If I was not married, I would ask her out.
Why would you not use a radio-opaque cement? Did you not listen to Wadwani, Pinheiro, and Hess at our study club meeting?
They are old school. My process is cutting edge. I'm going to charge other dentists to use my CT scanner and I will be able to buy an Audi R8 from Barrier Motors in 6 months.
You make me want to puke. Why are we having this conversation?
I want you to remove and replace Sally's implant.
Why don't you do that, since you're an implant expert?
An implant is expensive, and it will take too much time in my office. By the way, she is not happy the implant is failing. I want you to replace it at no charge. She will only have to pay out of pocket for an abutment and crown in my office.
You are freaking kidding. You cannot even restore an implant, yet you are placing implants. You destroy a beautiful implant that I have placed, and you have the gall to ask me to redo it pro bono, so the patient won't be unhappy with you, and you do not have to pay for the implant fixture. Is that correct? Dentists like you do patients and the profession a disservice. Please just get back in your BMW and zoom out here.
Oh, Zoom. We do Zoom in our office. It is very profitable.